All right, let's go ahead and get started with the Chapter 8, Part 2 lecture. This lecture references the Saladin textbook, Anatomy and Physiology, the Unity of Form and Function. And I've covered the axial skeleton so far. I'm going to be getting into ribs and the structures of the thoracic cage, and then moving on to the appendicular skeleton in this lecture. Okay, so ribs are going to attach to the vertebral column in posterior, and if you all remember the major sections of the vertebral column, which section of vertebrae will ribs attach to? Would it be cervical, thoracic, or lumbar? If you say thoracic, you are correct. So the thoracic vertebrae are going to be the attachment points in the posterior for the ribs. Most ribs will also attach to the sternum via a strip of hyaline cartilage, and the specific term for the hyaline cartilage in this area of the body is costal cartilage. When you see that word costal, think ribs. So it is histologically just hyaline cartilage, but it's specifically referred to as costal cartilage due to the fact that it is attaching to ribs. Okay, so with ribs, pairs 1 through 7, what this means is there's going to be one rib attaching to the left side of the thoracic vertebra and one rib attaching to the right side of the thoracic vertebra, coming around anteriorly and meeting with costal cartilage or otherwise forming part of the structure of the thoracic cage anteriorly. So pairs 1 through 7 are known as true ribs. That's because each one of these ribs has its own costal cartilage connection to the sternum. And if you have a chance to look at a full articulated skeleton model, usually the costal cartilage will be easily differentiated from the bones themselves. It might appear yellow or clear, somewhat translucent material. That's going to be the costal cartilage. So you'll see that the first 7 pairs of ribs have their own costal cartilaginous connection to the sternum. Now pairs 8 through 12, so going inferiorly, these are known as false ribs. That's because they do not have their own costal cartilage connection to the sternum. And again, you'll get a better sense of this when you actually look at photos or depictions, or also an actual articulated model of a skeleton. So these are false ribs. Pairs 8 through 10 are also called vertebrochondral ribs. They attach indirectly to the sternum by joining costal cartilage of the rib above them. And then pairs 11 through 12 are also called vertebral or floating ribs because they have no attachment to the sternum. They're only going to be embedded in muscle anteriorly. So the floating ribs don't have any connection. They don't have an indirect connection via costal cartilage above them, and they definitely don't have their own costal cartilage. And again, I recommend really looking at images to get a good sense of how the ribs are organized. So let's go ahead and look at this image here. True ribs 1 through 7. So we have 1, 2, 3, 4, 5, 6, and 7. And you'll notice this last one, this last rib, still has its own costal cartilage connection. So this section of material here, that is costal cartilage. And then this is rib 7. One rib in pair 7. And then this would be the other rib in pair 7. So see how that has its own costal cartilage connection? And then all of the ribs above that also have their own costal cartilage connection. They are directly attached to the sternum here. This would be the manubrium of the sternum, the body of the sternum, and then the xiphoid process of the sternum. So those are the true ribs. They each have their own physical connection via costal cartilage. The false ribs are ribs 8 through 12. So we have 8, 9, 10, 11, and 12. So those are false ribs. And the vertebrochondral ribs are the ones that do have a connection to the sternum, but it is an indirect connection. So notice with rib 8 here, we still have this section of costal cartilage, but it actually joins up with the section of costal cartilage in the rib above it. And again, we see that trend with these last few vertebrochondral ribs. And then finally, we have our floating ribs, which do not have any connection anteriorly except they are embedded in muscle, but they are not directly or indirectly attached to the sternum whatsoever. So that's why they're referred to as floating ribs. So this is one right here, and then this is another one. And this is just a transverse process of one of the lumbar vertebrae. The structure of a typical rib, there are several parts that will help you recognize how ribs actually fit into an articulated skeleton. The head is what articulates posteriorly with the facets or demifacets on the bodies of the two adjacent thoracic vertebrae. Then we have the neck. Then we have the tubercle, which articulates posteriorly with the transverse costal facet of the same numbered thoracic vertebrae. So recall how we have thoracic vertebrae T1 through T12. The ribs that attach to those thoracic vertebrae, in the case of the tubercles, that is going to be the same numbered vertebra attaching to the ribs. And then the shaft, which is basically the main part of the rib. So let's take a look at a couple of vertebrae that are articulated with one another and a rib. So you can see here that this would be the anterior, so this would be the sternum. This would be a section of costal cartilage. So this would be the sternal end of the rib. The shaft would be basically this whole long structure here. This would be known as the angle of the rib, basically where it turns to articulate with the thoracic vertebrae. Here we have the head of the rib, the neck of the rib, and then the tubercle of the rib. And then looking at a superior view, we have the body of one of our thoracic vertebrae. We have the articular facet on the tubercle of the rib here. So this would be the tubercle. An articular facet is just going to be the actual surface that you have joining via these ligaments to the transverse process of the thoracic vertebra. The neck of the rib, basically just the area of the rib between the tubercle and the head of the rib, which is going to attach closer to the body of the vertebra on the superior costal facet. So I always recommend looking at an actual articulated skeletal model to get a good sense of how the ribs and vertebrae attach. Okay, let's move on to the appendicular skeleton. Recall that there are kind of two main divisions of the skeleton. The first division that we have covered is the axial, and that's going to include the skull, the vertebral column, and the thoracic cage. The appendicular skeleton consists of the bones of the limbs, so upper limbs and lower limbs, as well as their girdles. A girdle is just going to be an attachment point for an appendage, in this case the limbs. So the pectoral girdle attaches the upper limbs to the trunk of the body, while the pelvic girdle secures the lower limbs. So this is a view of an articulated pectoral girdle. This is what's known as the acromioclavicular joint. This is the clavicle. And this is the acromion process of the scapula. So it's known as the acromioclavicular joint. Of course, we have the scapula, which is commonly referred to as the shoulder blade here. And then the head of the humerus. So this is the shoulder joint, and it is also the pectoral girdle because it is the attachment point for the upper limb. This is a right clavicle, superior view of the right clavicle. So this would be the sternal or medial end. So this is where you're going to see attachment to the manubrium of the sternum. And then this is the acromial or lateral end, which you see articulating with the head of the humerus. Now, the scapula itself has many very characteristic landmarks and features, which I will cover. All of these are going to be on your learning objectives for A&P 1 for the purposes of my class. So this is going to be the anterior view of the scapula. So if we are looking at the scapula basically from this angle, if we were looking at it from the front, this is what it would look like. This is the area known as the glenoid cavity, which what bone actually fits into this cavity again? That would be the humerus. So the head of the humerus, which is the arm bone, is going to fit into this glenoid cavity here. This is the coracoid process. Now, interestingly enough, this comes from the same word as corvid, which is the family that crows and ravens belong to. And when this was named, some of the early observers of this structure thought that this looked roughly like a bird's head. Hence it was named the coracoid process. And then this is the acromion or acromion process posteriorly. This is the superior border, which is just the upper edge or upper margin. The superior angle. This is the subscapular fossa. Sub means below. Subscapular fossa. And remember that fossa is basically a slightly concave or depressed area or basin within a bone. This is not going to be a fossa like you see in the cranial base. It's not going to be that obvious, but it is going to be slightly concave and it's going to be smooth. And the reason that is, of course, is it's going to be basically in direct contact with the posterior part of the thoracic cage. It's going to be gliding along the posterior aspect of the rib. So it is going to be a smooth, slightly concave surface. So that is the subscapular fossa, basically this whole area that is slightly depressed is the subscapular fossa. The medial border, remember that medial means towards the midline of the body. And you can remember this, of course, by looking for this glenoid cavity. You know that the head of the humerus is going to be articulating right here, so that has to be the lateral side because your arm is out to your side. So the opposite border is going to be the medial border. This is the inferior angle. And then the lateral border, again, you're going to know that this is the lateral border because it's going to be on the same side as the glenoid cavity. So that is the right scapula, looking at it from an anterior view. And then looking at it from a posterior view, you'll notice that this bone looks very different. So the way you can tell if you're looking at a scapula from the posterior view is if you see this spine of the scapula. If you see this uninterrupted bony ridge, which is the spine of the scapula, you know you're looking at it from the posterior aspect. And we can see basically all of these same structures with the exception of the subscapular fossa with this posterior view. We still see the coracoid process, the acromion, the glenoid cavity, which is always going to be on the same side as the lateral border because that's where the arm is, the medial border on the opposite side, the infraspinous fossa. So again, this is going to be a somewhat smooth, slightly concave surface. Infra means below. Spinous is referring to the spine of the scapula. So infraspinous fossa. And of course the spine itself. And then the supraspinous fossa, this somewhat smooth, depressed area above the spine of the scapula. Supra means above. And then the superior angle. So I think once you get a handle on just the names of these landmarks, that they are actually fairly easy to recall, because if you know the meaning of these individual words, then it becomes much more intuitive to actually point these out on the scapula. Okay, looking at the right scapula now from a lateral aspect, we have the glenoid cavity, which again is going to be where you have the articulation with the head of the humerus. So if we were looking at an articulated skeleton, we wouldn't actually be able to see the surface of the glenoid cavity because the head of the humerus would be sitting right within that structure. We can see part of the spine of the scapula here, the acromion, again the coracoid process. We can see the superior angle up here and the inferior angle down here. Anteriorly, we see the subscapular fossa. Posteriorly, we see the infraspinous fossa below the spine. Again, looking at this aspect, you see the supraspinous fossa right here. There are also a number of other bone markings, which I will not be asking you to know for the purposes of our lab practical. But just to orient you, this is called the infraglenoid tubercle, somewhat ridge right here, and then the supraglenoid tubercle at this point.